So hello, good day and welcome to this panel session where we will have the privilege today of hearing from three people who live with conditions where BI either has developed or is developing such therapies. I'd like to welcome our panelists for the session, Michaela, Nidhi and Regine, and I remind the audience that you can find their full biographies on the app. So let's get started by asking each panelist to introduce themselves with their name and where they're from. And their current role. So, Michaela, please tell us a little bit where you're from and who you are.
Good morning, everybody. It's pleased that I can join this meeting. I am from Prague, Czech Republic, and I am leader of a scleroderma group under already existing organization Revma League against rheumatism, and we are the members of PESCA also.
Thanks, Michaela. And Nidhi?
Hi, morning. My name is Nidhi. I'm from the Crohn's and Colitis Society of Singapore. I'm the president of the organization, as well as a patient diagnosed with Crohn's disease. Thank you.
Thank you, Nidhi. And Regine?
Hello, I am Regine. I am currently in Norway, but I am French. I am a board member of Lung Cancer Europe.
Thank you very much, Regine, and thank you all again for being here with us today to share your experiences, helping us to learn so that we can still improve what we do for patients. I'll come to each of you in turn through the talk for your comments, but please feel free to talk amongst yourselves as well. And really what we're keen to find out today is where you think Boehringer Ingelheim can really have a positive impact on the experiences that you're having, and that your members and your colleagues and friends would also have their illness. So first, Michaela, if I come to you, please tell us about yourself and your journey with scleroderma and your diagnosis and maybe how things could have gone differently.
Okay. I was diagnosed in 2015 with systemic scleroderma, which is an autoimmune disease which affects the skin and also internal organs, you probably know. The journey was quite difficult because this illness is not possible to cure, but it's possible at least to reduce the symptoms or slow down the illness. I was lucky because I was diagnosed only 5 months after the first symptoms, but it's not very usual. A lot of patients are diagnosed many years, later, which it's a problem because afterwards it affects more for example, internal organs. Unfortunately, I have a diffuse scleroderma with quite a huge progression. So the same year I was diagnosed, I ended in a coma with kidney failure and other serious complication. It was, I nearly died. So this illness is not, it's quite serious. It can affect only skin. It means it's less serious, but it affects everyday life of patients. What was the most challenging in at the beginning for me was the lack of information, because the rheumatologists, they have just 30 minutes for you, and this is such a complex disease that they can't really introduced you to this illness. They can't give you all the information, what can happen, and so on. So that's the reason why I established the patient group, of course. Would you like now to shall I say now how you can help, or
please feel free to throughout the conversation we'd like to hear any suggestions or any hints that you may have for us, so please feel free.
We already cooperate with local Boehringer, which is great support for patient group. And I think the main thing is to provide the correct information to the patients, enough information, because they should avoid such things like kidney failure and all these things. So they should know what should do, what should they measure, and all these things. So we created the brochure for the patients, but also we create the brochures for the practitioners, which is great help, because a lot of practitioners, they never met the patient with systemic scleroderma. So it's difficult for them to make sure they are early diagnosed. So with the local help of Deringer, we were able to distribute these brochures to over 4,000 practitioners, which is great help. And in my point of view, it would be great if there can be, for example, the meeting arranged with practitioners to educate them about such an illness or other illnesses which are not well known. And of course, the education of the patients is important as well, but it's part of what we are doing in a scleroderma group as well.
Great, thanks, Michaela. It's a great start to kick us off on the panel. And I'd like to turn to Nidhi now and ask, really, with your experience with Crohn's, are there similarities that you're hearing? And just tell us about your journey through your diagnosis and how that was could possibly be impacted.
Thanks, Richard, for the intro. And Michaela, you've gone through a lot. In my case, my symptoms started in 2009, but they were so diffuse. If I can count the number of specialists I have seen, I think there are more than 10 different specialists, meaning starting from an ENT specialist to a cardiologist, a neurologist, rheumatologist, skin specialist. The list goes on. All the specialists you can think of, I had visited each one because my symptoms would last 2 to 3 months and then it would shift to some other body part. And each one of the specialists would say, yes, there are clearly some signs, but there's no conclusive evidence that you have A illness or B illness. So there was no diagnosis. So for more than a year, I just kept going from one doctor to another and reached a point where a neurologist actually told me that you might want to see a psychiatrist. Because I kept insisting that I have a lot of fatigue, and nobody could understand what I meant by that. They just felt that I was 40 plus and I'm speaking like a 60 plus year old person, and something is definitely wrong up here. So that was pretty challenging, but I actually went and saw a psychiatrist because I didn't want to prove them right, that something is wrong with me in my head. So when I saw the psychiatrist, he was very clear that some of my symptoms were like, when I lie down, I would feel extremely dizzy and as if my head is falling into a valley. And I would wake up from a nap or from a deep sleep and I would have palpitations. So he was very clear that these symptoms were not cooked up in my head. They were really physical and I should be seeing a cardiologist next. So the journey just went on, and although Crohn's disease is a digestive tract illness, it's an autoimmune condition also, but I had no symptoms of the digestive tract, zero. All the symptoms were outside of the digestive tract. So nobody even suspected I could have Crohn's disease. And it went on for more than a year when I also went to India from Singapore, thinking they have a huge population, maybe some doctor knows of some illness that maybe in Singapore they don't know of. And there it's one of the doctors who said, in fact, it was a rheumatologist who said I might have some kind of an autoimmune condition. But nothing could be done because there was no conclusive evidence. That's where I learned there are 100 types of autoimmune diseases. And unless and until there's a clear symptoms, they cannot diagnose it. And hence treatment can't start. So naturally, I felt I was sitting on a time bomb. One day it will just explode and maybe the doctors will say, oops, it's too late. We can't do anything. That was literally my mindset, that I've reached a point where I might have a terminal illness. I might have only another 3 years or 5 years to live, because I've seen so many specialists and nobody can tell me what's wrong. I was miserable, but I was pretty certain that there is something wrong with me, meaning physically, because I could sleep 8 or 10 hours and wake up extremely tired. I was the director of the Rotary Foundation here, and doing my job was extremely challenging. I worked part-time, tried to manage family and work, but I just couldn't. And so literally after 2 years of the first symptom, I was diagnosed because I had a major episode of diarrhea. I went, I think, 20 times in a day. And that's when I got diagnosed with Crohn's disease. But yeah, it was a challenging 2 years.
A tough trip, sure. So it'd be interesting to explore later how maybe we could have, or that there could be different information. And I noted here the fatigue and the psychiatric impact, and how you felt desperate without knowing what was wrong with you. And I think there's a lot of similarity there with what Michaela was talking about. Although Michaela only took 5 months to diagnosis, it still must have been a challenging period for you too. And then Regine, for you with your journey, and that was a bit longer ago, I think, but please tell us about that.
My journey was quite different from the other ones you have been presented to today, because I had absolutely no symptom at all. I got lung cancer when I was 46 years old. I just wanted to start deep sea diving, and I needed a certificate from my GP that I was fit to it. And to get this certificate, I needed to have a chest X-ray, and that they found a tumor. I was really shocked because I was feeling healthy and had no symptoms. The problem was when I was diagnosed, I knew nothing about lung cancer. So I went on the internet to try to find some advice there. I should never have done that. What I found out is by then, the overall 5-year survival rate was only 1%. No, it's better due to new therapies, but it increased only to around 20%. And we need to know that lung cancer is the main cause of cancer-related deaths in the world. Mm-hmm. It causes more deaths worldwide than breast, colon, and prostate cancer combined. I was lucky because my tumor was at stage 1, and I could just get surgery. The major issues around lung cancer is that at the beginning, the patient has no symptom and makes it very difficult to get diagnosed. When you get symptoms, it's already at the late stage. Mm-hmm. So we need to think about it.
Need to think about it. Thanks, Regina. Thank all of you for sharing the story of your diagnosis and your entry into the system of the health services in your countries. If we could move on now, maybe to think about living with the conditions and what your day-to-day experiences are, and maybe some of the biggest challenges and how you overcome them. So, Michaela, back to you as we go in alphabetical order again. You could tell us some of the biggest challenges that you have, and again, if we could think in terms of how BI as a pharma company might alleviate or improve some of those experiences that you have with your condition.
Okay, I have to point out that it's everyday challenge to live with this, but to take it, and it's part of my life. So the only way is to get on with it. I think I had a similar challenge like Nidhi, because I was lack of information. I was, or Regine, I was searching on internet, which is the worst thing I could do. Because, there are the worst stories, cases, so it scared you only, and you will get under depression very soon, and the stress affects your illness, so the illness starts to move quickly. So that's the thing which I would avoid in future, or wouldn't recommend to anybody. Of course, the challenge for me was also because I was 3 months in hospital, 2 years on dialysis. So 3 times per week I was in hospital, and 3 years I was addicted on the help of others. So I wasn't able to do the daily stuff because I didn't have the energy. I felt sick. I had 20 kilos less than usual weight. So I couldn't move. I wasn't walking at the beginning at all. And after I was slowly start with the movement. So you can imagine that it's really, really difficult. This illness also affects the hands very often. So the patients very often can't do the stuff with their hands. I'm lucky again that I can do. And the reason as well, I think it's that I did my exercise at the beginning, from really the start of the illness, which was very painful, wasn't very comfortable, but it's important. And very often I think the doctors forget that the people need to start with rehabilitation visit very soon, especially in small cities, small villages. It's not really supported this way. And then the people are losing the ability to do the daily stuff because their hands are really not working, because they are cruel, and it's not possible. Another challenge, which I think it's quite important, is that, as I mentioned, the systemic scleroderma is not possible to cure, but there are some medication which are not already approved for such an illness. And it needs to be approved by insurance every 6 months. So it's really very stressful if you get this medication or not, if you will get to this terrible stuff, which you was on the scale of 10 on 1, because you wasn't able to live at all. And very often the people will not get to this treatment. Of course, it doesn't mean that there is a one great medication which helps everybody. Everybody react on a different medicine. It's such a complicated and complex illness. So I think these are the major. Also, what I know, it's not my experience, fortunately. But some patients have experienced that the practitioners doesn't want to take care of them because they don't know the illness, they are afraid, and they always send them to the rheumatologist. But the rheumatologists are fully booked, so it's not able to visit them just because you have a cold or you have something, something wrong with you, but it's not related to your illness. So this is really an issue. So I think the practitioners should be more educated, and they should be able to treat the people with such diseases.
Sure. Thanks, Michaela. I think that's a very key point there, that we're all people first before we're our disease and our label. And if we have a diagnosis of something, doesn't mean that we don't get the everyday illnesses as well, which can be dealt with by the everyday.
And I think this was also my issue when I ended up with kidney failure, because I was in a situation that I didn't know. I said, okay, I'm not feeling well, but is it normal because I'm taking this medication, or is it because of my illness? And I didn't know, should I go to the practitioners? Will she know what's going on? So that's all these things which patients shouldn't think about it. They should know who should they visit, and they should really feel that the person will help them, at least, to clarify or to support them or send them advice or whatever.
Yeah. Thanks, Michaela. And Nidhi, for you, you mentioned this issue with going to the bathroom 20 times in one day, which clearly is a major impact on anyone's daily routine. How do you think that we could help with that situation? And also thinking broadly about the healthcare system there, Michaela mentioned access to medicine. Is there some way that BI, pharma and patient organisations could work with the system to improve the situation? What do you think, Nidhi?
Yeah, I think I would maybe briefly share how it's categorized. Because Crohn's disease and ulcerative colitis are two conditions that are called inflammatory bowel disease, IBD. And in IBD, they could be mild, moderate, or severe diagnosis of the illness. And my case was a mild case, but at the same time, my case was of extra-intestinal manifestations. So I had to see almost 5 different specialists for the last 8 years because I had digestive issues. In addition to that, I had fibromyalgia. So I saw a rheumatologist for that. Eczema, so a dermatologist for that. Sleep apnea, so I have a sleep specialist. And I can't even remember. I think there's a neurologist and there's a gynecologist. There are a few different specialists who are taking care of this one body. But the challenge I feel, I can manage my problem with the medication. I just believe that we should follow what the doctor is advising us. So I take every dose. I had to take 10 tablets a day. And for 8 years, I didn't miss even one dose. So I just did my part. But when it comes to the general population, they look at me and I look okay. So I think the challenge lies in trying to tell them, hello, it takes me a lot of energy and effort to seem okay. It's my choice. Yeah. I could have chosen to be miserable, that I have this horrible illness and I can be crying about it or be miserable and be at home depressed. Or I make a choice to go out and I actually set up the charity to help other patients. So it's a very conscious effort to do things with my life that I had to read up what the illness is all about, because we had not heard of this illness in the past. Nobody in my extended family heard about it. Although Dr. Google says genetics plays a role. So there might be someone in the family, but probably in those days and ages, they didn't have this kind of a diagnosis and people might have just moved on. But whatever it is, what happens in this day and age is people look at you and then they come to the conclusion that you are ill or not ill. So this being an invisible illness, people just don't get it, that you are unwell. So when I explain to them that I have 5 specialists taking care of me, that's when they get it. Yeah. And the next thing is when you tell them I have Crohn's disease, they're like, huh, what is that? So people really don't have that awareness. Then when you explain that, okay, Crohn's disease affects your digestive tract, and then very briefly you explain what happens. People go to the toilet numerous times. Some of them have a lot of blood being lost through the bowel movement. Then suddenly they are experts. Yeah, they would start advising you, you should be eating this or not eating that. And, you know, the whole advice starts coming out. And I'm like, okay, thank you very much. I know you mean well, but let me follow what the doctor is advising me. So I think that's where one of the day-to-day challenges lie, that family members don't understand. I'm just one of the fortunate ones that my husband is a scientist from biological sciences. I have a brother who's a doctor. So again, where like Michaela was saying, that the one specialist doesn't know how to manage the condition and sends you to another specialist, right? So my brother is an internal medicine specialist. So he's able to put all these different specializations together and say, oh no, actually, this could be affecting that, and hence you need this specialist. So I think what we need is an overall case managing system where chronic illnesses are managed by a person who knows the entire body, not just one system, and tries to manage such a condition. Because we have, like my kind of case, where the Crohn's disease is not just limited to my digestive tract. So science, although comes along to say that, fibromyalgia is not connected to Crohn's disease. There's no evidence. So I just joke with the doctors that it might not be in science, but it exists in my one body. So it is connected. So please don't tell me it's not connected. I just laugh. So I joke about it, but I guess that's where pharma companies like BI could play a part.
Around information and education.
Yes, information.
Thank you.
If I just say something to this point, I just agree with you, because it's similar in our country, where I feel the specialists are not communicate to each other, but it's still just one body, one person, and a lot of issues in your body. but everybody is just taking care of their things, but nobody will sit down and see it as a complex.
Holistic.
So somehow finding that holistic approach, exactly. And Regine, what are your thoughts here, Regine? What challenges do you face? How might BI be able to impact on that for your community?
Privately, I was so lucky to get surgery, so I don't have many challenges. But that's why I decided to advocate for other lung cancer patients, because, as I told you, most of them are diagnosed in late stage, and then we need drugs. Boehringer has already done something because they have some drugs for us, some targeted therapies, and we are very happy for that. But there's still a lack of research funding for lung cancer. We would like to have more. There is new drugs on the market, but to get the drugs, you need access to molecular testing. In many countries, you don't get it. The same, you have access to drug, but it takes too long time before from the payer side to approve the reimbursement of the drug. So you can imagine how difficult is it for a patient. They know there is a drug somewhere that they could save their lives, but they don't get it because it's not approved. But it's very important for Boehringer to work there, to push on access to molecular testing, access to drugs. The payers need to reimburse as soon as possible. And at the least, it's important too to give access to clinical trials. As in many countries, the only way a patient can get a drug that they need to survive is being a part of a clinical trial. So that's something to think about too.
Thanks, Regine. Some very clear calls to action there for us to think about and to take action on. I'm not surprised. We're nearly out of time already. We've only asked a couple of our questions, but we've got a minute each left. So, Michaela, if it's okay, in 60 seconds, perhaps what would you tell somebody who's experiencing symptoms of scleroderma that they should do, that you wish you'd known at the time?
Definitely not to search your diagnosis on internet. Try to contact your local patient organization if exists, because they have a valuable information and they will support you and give you the experience. And always ask the doctors for the options of the medication if the current medication is not working. Because if you don't ask, nobody will offer you anything else. So just ask and educate yourself in the illness. This is the main thing I think I would recommend.
That's great, and perhaps we could help with creating that with your organisation to make that available. I'm not offering things, but just throwing things out there to think about. And Nidhi, for yourself, a similar question in a minute. What do you think you would tell somebody with going through what you went through?
I would still tell them the same thing that I did. Don't give up, even though it might feel like, maybe it's not happening, but you know your body best. So if you feel something's wrong, make sure you keep pursuing to get a confirmed diagnosis. It's crucial. Only then treatment starts. And surprisingly, I was not told, but today I am drug-free for the last 9 months. And without medication. The doctor has approved that I can stop my medication. So there is hope. It doesn't mean that we are diagnosed with the illness, means we have to keep taking the medication for life, which is what I was told. But it seems like more research is needed. There probably is a possibility of stopping medication for a bit. And if there's a flare-up, then we go back on it. So more research is needed, that's for sure.
Thanks, Nidhi. Again, very clear on that. And again, the positive mental attitude coming through very strongly. Thank you. And Regine, final words to you and the same question.
Yeah, first of all, I would say to the patient, there is hope for you because new drugs are coming on the market, but you need to know about it. So the best is to contact a patient organization because they can advise you. They even know mostly more than your GP because they have a wide knowledge about this one. And your GP maybe is having 1 or 2 lung cancer patients during a year. So they are not updated in everything. And then I would like to tell them, ask for a second opinion if you're not quite happy with the first one, and search for clinical trials that are enrolling patients.
Perfect. Great. So thanks again. All that remains for me to do is to say thank you again, Michaela, Nidhi, Regine, for your insights today. Very valuable and highly appreciated by all of our colleagues and myself. We're truly grateful. And to you three and everyone watching and listening today, please stay well. Thank you.